So this is the cath labs. My name's Elena. I'm one of the cardiac physiologists here at Royal Papworth Hospital. And I'd love to show you around and show you what we do in the cath lab. So let's go through. So I'm going to take you through to cath lab 5 now, so you can have a little look what's inside. So come this way. Hi, so this is our cath lab 5. And in here we've got our X-ray camera. And this will be able to come over the bed and X-ray our patients. And here, this is our anaesthetic team. So they will have all their equipment here ready for our patient to sedate them. And over here, this is where we're going to get all our images. So if we're doing PCI or whether we're doing EP, all the images will be projected on here for our operator to see. And over here, we've got our monitoring, which our nurses uses, our Mindray, and this is interchangeable with the wards as well, so the patient can come straight in and be monitored straight away. And here, our radiographers will use the Philips equipment to be able to control the X-rays over here for the operator during the procedure. And over here, this is very exciting. We've got all our EP equipment here on this stack. So this is movable and it's all hydraulics, so that's one thing we loved when we moved to this hospital. So in the EP lab, we use things such as CARTO, cryo, Rhythmia, and we're able to use all of this equipment to be able to support the EP doctors to be able to look at the electrical activation in the heart and help to get rid of pathways so that patients feel better with palpitations they may have had or arrhythmias they might have had as well. And over here, this is our ultrasound machine. This is what we can use, and we've got one of these in every lab, which is really fortunate. We can use this to ultrasound the heart if that's needed during the procedure, and it also has the luxury of having different probes, so we're able to gain vascular access using the probes on here as well. And if I take you over here, this is our solution to being paperless in the hospital. So when we do pacemaker implants or defibrillator implants or cardiac resynchronization device implants, we are able to take the information from the programmers and without any paper at all, send this over to this device, and then that sends it to our electronic medical records. So completely paperless, and for our patients it means that we've got all of their information all in one place, accessible for all the clinical teams to be able to see it. And behind this LED screen is where the cardiac physiologists and the radiographers sit, and this is where all the monitoring happens. So let me show you here. So this is where we do the monitoring, and our cardiac physiologists sit during the EP procedures or pacing. And on here we would use the CARTO equipment predominantly, and here is for our monitoring of devices when we implant them, so we can see the ECG as we go along. And over here, this is our radiographers. They sit here and they can work remotely from behind the screen if they want to, but often they choose to stand outside with the operator during the procedure to monitor our patients. And at the end of the control area, this is the hub of all the information and all the data that we have. So which is really, really good when we moved hospital is the communication has been so much better because of these. So we're able to put these on and the operator can have these as well, so we can hear everything that's being said, which is crucial during the procedure. Okay, so here we are in another lab, and this is where we do our structural work. So this is where we put transaortic valve implants in. So this service has increased exponentially over the last couple of years. Our numbers have actually doubled, and what that means is patients that might not be suitable for open heart surgery can come to the labs and have their valve implanted. So let me hand you over to Hannah. She's going to tell you a little bit more about our PCI service. So this is Hannah, and Hannah's going to take you through all about the PCI lab. So I'll hand over to Hannah now. Thank you.
Thanks, Elena. So we're in Cath Lab 3. This is one of our angiography labs. We also do PCI in here, sometimes primary PCI. All of our equipment's over here. So we've got some catheters there, balloons, some coronary stents. We also have specialist equipment like IVUS, OCT, and pressure wire system in the lab, and it's all integrated on our screen here. Our primary PCI service has massively increased over the last year. This is the service for emergency heart attack patients.
So as part of the cath labs, we have the bronchoscopy suite, and I've got Anna here. She's one of our nurses, and she's going to tell you a little bit about what they do there.
So in bronchoscopy, we basically introduce a scope with the camera at the end. It goes into the lungs and kind of like look at the anatomy, and we perform this for diagnostic or therapeutic purposes. We cover a range of services, including oncology, interstitial lung disease and transplant patients.
So that concludes our tour of the cath lab and bronchoscopy. I hope you enjoyed it at Royal Papworth Hospital. Thanks a lot.